Quick note, this is an AI-assisted recap made for learning, not the original video, and not an official translation. In this episode, Harvard gastroenterologist Dr. Trisha Pasricha joins Mel Robbins to answer the gut questions most of us are too embarrassed to ask out loud. Think bloating, constipation, and what your poop is really telling you. Nothing here is medical advice, so treat it as a friendly map, not a diagnosis. First, the big picture. Your digestive system is basically one long tube that runs from your mouth all the way down to the other end. Along the way it breaks food down, pulls out the nutrients and water your body needs, and then moves whatever is left steadily toward the exit. So your stool is really the leftover story of that whole journey. That is why doctors treat it as a surprisingly honest daily report on your health. Here is something wild. Your gut and your brain are wired directly together by a huge nerve highway, so the two are constantly sending signals back and forth. That is why stress and anxiety so often land right in your stomach, showing up as cramps, nausea, or that heavy knotted feeling before something scary. It also means a gut feeling is not just a saying. Dr. Pasricha explains your gut genuinely reacts to the world, sometimes before your conscious mind catches up. Now, why the urgency? Across her clinic and the wider field, doctors are simply seeing more gut trouble, and they are seeing it in noticeably younger patients. Colon cancer, which people once pictured as a disease of old age, is now showing up more often in people in their 30s and 40s. That shift is exactly why this conversation matters. If you do not know what normal looks like, you cannot spot the moment something quietly starts to go wrong. So what is normal? A healthy poop is generally smooth, formed, and shaped like a soft sausage, brown in color, and comfortable to pass without straining. Frequency is more flexible than people fear. Anywhere from about 3 times a day to 3 times a week can be perfectly normal, as long as it feels easy. The real signal is change from your own usual pattern. Your personal baseline matters far more than hitting some perfect number you saw online. Let us talk constipation, since almost everyone hits it sometimes. The number one cause is simple and boring: too little fiber and water, plus sitting still all day. Fiber gives stool the bulk and softness it needs, water keeps everything moving, and simple daily movement like walking gently wakes up your intestines. Her advice is to reach for these small, steady habits first, long before you gamble on harsh laxatives or trendy quick fixes that rarely solve the real cause. Now the part to take seriously. Certain signs are worth a doctor's visit, not a panic, but a real appointment, because catching problems early genuinely saves lives. Watch for blood in your stool, an ongoing change in your habits, unexplained weight loss, or new pain that lingers instead of passing in a day or two. None of these automatically mean something is wrong, but they are your body asking for a professional look. When in doubt, get it checked rather than wait. Here is a habit almost everyone has, and the doctor really wants you to break it: scrolling your phone while sitting on the toilet for far too long. The longer you sit and unconsciously strain, the more pressure builds on the veins down there, and over time that steadily raises your risk of painful hemorrhoids. So follow the rule many gut doctors use themselves: aim to be done within about 5 minutes. If nothing is happening, get up and simply try again later. This is where she pushes back on the wellness hype. A healthy gut and a balanced microbiome are not built by expensive powders, cleanses, or miracle detox teas. The unglamorous basics are what actually work: plenty of fiber and water, daily movement, decent sleep, and a fairly regular routine your body can quietly count on. Your gut bacteria feed on a wide range of plants, so a colorful, varied diet does far more for your microbiome than any single pill ever could. So here is the whole protocol, and it is refreshingly simple. There is no shame in any of this. Your gut is just another part of you that needs care. Feed it plenty of fiber and water, move your body every day, respect the 5-minute rule, and never brush off the warning signs that deserve a doctor. Remember, this recap is for learning, not medical advice, so see a real doctor for anything worrying. The original episode is linked in the description. See you next time.